Good morning and welcome to COVID-19 Talk with local health authorities. We have Dr. Erica Brown, welcome, representing Harris County, Dr. David Purse representing the city of Houston. Special thanks to past president Kathy Fenninger, Rotary Club of Houston, and our producer Morgan Ash. I'm Stephen Williams, the director of the Houston Health Department. Let's kind of jump right into this. A lot of questions just because of tests and everything else that's going on. The first one is on transmission. More than 400 people are admitted to the hospital each day in TMC. Can the virus burn itself out?
So I'll take a stab at that. We really don't have a whole lot of information yet about what this new variant is going to do. While we do see our numbers falling, and we do anticipate that we will move out of our peak soon, we really can't answer whether the virus is going to burn itself out. When we take a past look at what it's done thus far, it probably won't burn itself out. Rather, we will develop some additional immunity to it.
Are infections leveling or going down? What about hospitalizations? What about mortality numbers?
So I'll take that. The most of the numbers where we look at wastewater, positivity rate, the new cases per 100,000, hospitalizations, they've all started to come down. Now, one little thing about that to keep in mind is that while they're coming down, we're at levels higher than we've had ever before, particularly in terms of overall hospitalization. And that's an important metric for us to watch, because any of us can need a hospital bed at any time. And if the hospital is already full, you're going to wind up waiting. So that's an entire societal impact. Now, the deaths, that is a lagging indicator, and that can lag weeks behind. So we've not seen a lot of deaths with Omicron. So it's still creeping up, but at a very small percentage. So most of the numbers are moving in the right direction.
South Africa cases went up rapidly and now coming down just as quickly. How far behind them are we? And do you think we will continue to mirror other countries who have been a couple of weeks ahead of us?
So I'll take that one. I do think that we are going to mirror what we've seen in South Africa and in other countries. Again, we are starting to see a potential decline. It's very early to say, but hopefully within the next week or two, we'll see even more of a decline. But this will be different than other parts of the country. We'll be hitting decline at different times. So for instance, the Midwest is currently still in their peak. So while we will see a decline across the country, it's going to be at different times.
The portal is now open for 4 free rapid home tests per address. What about multiple families at one address or more than 4 people per home? How long is this scheduled to continue? Do we know that?
I don't think that we know that. My understanding is that, it says 4 tests per address. So even if you live in an apartment complex, your address would be that unit number would be one address. But we do know that we have some apartments where you got 10, 12 people living in the same apartment. So 4 tests wouldn't be enough for that. The other thing is, if I understand correctly, and I invite Dr. Brown or you, Stephen, to correct me, is that I believe that you can test or you can order them once a month. So you may be able the second month get more. But that's the extent of what I know. Does anybody else know anything more detailed?
I think it's important for y'all to talk about the most appropriate use for these tests.
Yeah, so this is one of my favorite areas, so I'll jump in on this. So I think that people need to understand with the rapid tests, there is a percentage, we think it's around 20% of what we call false negative rates. That is generally occurs when somebody is becoming infected and potentially becoming ill later on. And basically what happens, you've just tested too soon for there to be enough virus on the swab for the test to turn positive. If it's positive, it's very specific. So you probably almost certainly have it. There's very low likelihood that you're going to get a false positive. So there's no need to go on and get another PCR test. would just confirm it. The PCR tests are far more sensitive. So if you're worried that you were exposed to somebody and you get a at-home test and it's negative, but you still are worried, that would be the time to go on and get the PCR test because it's far more sensitive. If you are on the backside of your illness and perhaps your employer needs you to have a negative test to return to work, that's where the at-home tests are good because, and there's some controversy about this, but we believe that if you are still producing enough virus to make you contagious, you should still test positive on the at-home test. Whereas with the PCR test, you may be not contagious at all and well over your illness, but because the test is so sensitive, it will continue to test positive because what they call viral debris is still in your nasopharynx and it'll pick it up. So a little bit of understanding about the pluses and minuses of the two different types of tests is important here.
Positivity rate on January the 10th was about 38%. Of course, without home test results added. What do you think the actual rate is?
I can take that. We really can't tell what the actual rate is, especially with the introduction of more home tests. So based on what we know from our hospitals and our health systems and our care environments in the community, and what they're sharing with us, our positivity rates continue to remain high, but again, are falling. Again, with the introduction of the home test, it's really difficult for us to tell for sure what the true positivity rate is.
On January the 7th, I had a positive rapid test by swabbing both nose and throat and a negative with just the nose. For future reference, what is the most accurate?
Yeah, so this is an area of active research right now. So we are finding that, you know, with Delta, it seemed to be more of a lower respiratory tract infection. With Omicron, it seems more upper respiratory. But there are a couple of studies out there showing some conflicting results about which site is better to test, the throat or the nose. And so I don't know what the most recent is, Dr. Brown. Do you happen to know? But I do know that what this person has observed has been observed by the researchers as well.
Yes, I don't have any additional information. I would say though, and like to add that for the home tests that are approved in the United States, all of them are nasal tests. None of them are approved for the pharynx. And so I'm not quite sure. I'm a little bit confused at the question in that the positivity results that you received may be conflicting if the test was not administered correctly.
Okay. Dr. Percy, you said the test from January 3rd shows virus spread is slowing. Any updates? That must mean the wastewater.
Yeah, I'll assume that was the wastewater. And so what the wastewater...
Let me ask the second question so you can do both of them.
Okay.
There are new variant hiding in the wastewater. So I think both of those questions are relative to wastewater.
Yeah. Okay, great. So yeah, and so the wastewater, the good news, the wastewater continues to come down. The amount of virus in the wastewater continues to come down. The wastewater is examined, if you will, we look for new variants, and it's a real challenge. And I think we really need to give credit to the people in the lab, because you imagine when you test an individual and you put the swab in their nose and you get it, you tend to get the entire viral particle that they can sequence in the lab. When the wastewater is all broken up into bits and pieces, and so they're looking for the specific bit or piece that aligns with Omicron or Delta or is something we've never seen before. And so it's a much greater challenge, but yes, they are looking for that. They routinely look for it. We're also looking for other viruses. So right now we're looking for flu. There are some other pathogens that cause diarrhea that we're just now testing to find out if we can, well, actually we know that we can, and so we're starting with some research projects. But the point is that there are many, many different pathogens, not just viruses, that we are learning how to detect in the wastewater.
Are kids getting long-term COVID?
So we haven't seen that yet. I think it's too early to tell with the data that we have, especially with the Omicron variant, which is unfortunately what most children we're seeing with children now, and we just don't know. So the data will tell us later, but we don't have an answer yet.
So we'll wait and see on that one.
Yes.
Is it true that younger people have less possibility of hospitalization regardless of their vaccination status?
So that's a complex question. So on one hand, overall, most times the admission rate of children who are infected with COVID is less than what we're seeing with adults. However, within that group, we are also seeing what we're seeing with adults, that those who are unvaccinated are at greater risk than those who are vaccinated. So it's the same thing. The younger and healthier you are, you're less likelihood of requiring any hospitalization. But if you're unvaccinated, you're at greater risk than those who are vaccinated.
Since kids 0 to 4 can't get the shots, how do we keep as safe as possible at daycare and preschool?
So I think some of the common things that we have already been talking about through this entire pandemic, social distancing, good hand washing, wearing a mask as best as possible. Now, understanding that kids 0 to 4 really can't wear masks and the toddlers really don't wear masks. Those around them for sure wearing masks. And then one thing that is absolutely key for those that are around them, if you're sick, or if you think that you're coming down with something, to stay away.
So back to basics with that.
Back to basics, yes.
At what age can you independently get a vaccination without parental consent? My 12-year-old niece desperately wants to get it, and her parents refuse. I'm reluctant to go around my stubborn brother.
Yeah, so my understanding of that is that the age of consent is 18. Now, there are certain exceptions. For example, if you're active duty military and you're under 18, and there's some other legal constructs about that. But for the most part, you have to be 18 to get vaccinated or under 18 with parental consent.
Cloth masks are out, and you've said to go for ones like KN95. Since they are still not readily available, are KN95s the next best? Is there a country of manufacturer that is recommended? Some have a code on the mask. Is that something to look for?
So actually, since that question was submitted, as we've seen on the news, that has changed a little bit. So there will be N95 masks and KN95 masks readily available. As far as manufacturers, the United States has N95 manufacturers, and for us, 3M is one of our most predominant manufacturers. When we're looking at the KN95 mask, which is the Chinese version of the N95 mask, you are correct. There are codes that specifically tell us that that mask is not a counterfeit mask, frankly. At the code, just briefly, is GB 2626-2019. If you see CDC or other approvals on it, that is not an approved mask that was specifically made in China. However, that doesn't necessarily mean that we should not and you cannot use the mask. The key is to get the best fit is for that it should fit snug around your mouth and your nose, okay, which is what the N95s should do as well.
So while you were repeating that code, I was looking at this bag of KN95s on my desk. It had the code. Hey, it does have the codes.
It does have.
It have that code. So, so just a follow-up question to that. So, are we discouraging people from wearing cloth masks?
Absolutely. Cloth masks really are of least benefit to you. If there is nothing else available, a cloth mask is better than no mask, but cloth masks really are of little benefit to you. They're too loose, and the holes in them in the fiber are too big to protect us from particles.
Yeah, if I could add in, I think that, part of this is a great example where our messaging throughout the pandemic has gone a little bit awry. So the cloth masks really are not very good at protecting you from somebody else. But quite honestly, we've never said that. What we've been trying to educate folks is that the cloth masks, its utility is that if you are infected, it minimizes how much you spread to the next person. So if you're in a room full of people who are only wearing cloth masks, the risk is reduced because, let's say, making up numbers, let's say you got 10 people in the room and one of them is infected and they don't know it. If everybody's wearing a mask, then the chance of transmission is low because that infected person should be wearing a mask, catching much, but not all of the virus that they would otherwise be expelling. So in our messaging, I think we got missed that the cloth mask is now coming to be widely understood is not a great protection for you. It's really effective when everybody wears them. Today, when most people are not wearing masks, this is why it's important, because if you're in that room and you're the only one wearing a mask and you're wearing a cloth mask, it unfortunately is not providing you much protection. Morgan, you're on mute.
Thank you. Good morning. I'm Morgan Ash with the Youth and Health Department, and we're having a technical difficulty with Director Williams, so I can ask some questions. The next one is, some experts predicted a peak on January 28th, and others said we are at the peak now. Where are we?
So I think we answered that question a little bit earlier. It's early for us to tell. In our county and in our city, our numbers are starting to decline, but it's a little bit early for us to say for sure that we have reached our peak and are on the decline.
Next question is, just had a regular blood test, coincidentally after having COVID. It shows liver enzymes up for the first time ever. Nothing health-wise has changed, and I do not drink. Have you heard if COVID might be the cause of the elevation?
So I'll take that, but I will happily let Dr. Brown, if she knows something more specific. So the one thing that I would say is that if this virus has taught us anything from the beginning, is that unlike most viruses, this virus will attack any organ system. So we've seen complications of the skin, the brain, the eyes, the heart, the lungs, the intestines, the kidneys. COVID toes was popular for a while. Well, not popular, but it was making a lot of attention in the media. So this virus can and will attack any organ system, and it's almost unpredictable. So in your case, could the bump in your liver enzymes be due to the COVID? It's possible. But I would absolutely work with your primary care physician, because there are many things that can cause problems with your liver that you need to pay attention. Alcohol, clearly, everybody knows can do that. You don't drink, but there are other things. So you need to work closely with your PCP to find out what's going on.
Go ahead.
You're on, Director Williams. We got you.
Yeah, important. The next thing is that I have another one of these after this one. Which one did you leave off on?
The liver, someone was asking about liver enzymes and liver enzymes.
Okay, why don't I just start with the rules? Is CDC making decisions based on science or the economy with the latest isolation advisory guidelines? It appears that there's societal pressure to get people back to work as quickly as possible.
Oh, David, I want the liver enzyme question. So CDC absolutely bases their recommendations on scientific evidence. Having said that, we are absolutely to a point in our economy and across our country where we have to balance the social needs that we have with what is good medicine and good science. So I think that the answer is they will never put us in jeopardy in terms of our health and our safety, but there absolutely is a component of balancing the need to maintain our stability, both socially and economically in the country.
Hey, can I add to this, because I think this is an important question, and I complete with everything that Dr. Brown said. And the other part of this is, let us not forget that there is what I term collateral damage. If we were to, do what the science indicates to slow down the virus, we would basically all still be in lockdown. But just with children, for example, not to mention, and the impact of them not being in school, there are other negative impacts sometimes from the non-pharmaceutical interventions that we can cause. And another group that I like to remind people of is that, the death rate amongst people with heart disease who are not infected with COVID has gone up because they're delaying seeking care. They're getting to the hospital later in their heart attacks. There are other very serious health consequences. So the CDC is in an extremely difficult position of trying to balance what is best for the whole population, not just each individual each individual one of us. So they're in a really difficult position, and I support the efforts that they're trying to make.
So it's not about societal pressure. It's really about a balance, and they're not really putting us at risk. I am going to give you your wish, Dr. Brown. Just had a regular blood test, coincidentally after having COVID. It shows liver enzymes up for the first time ever. Nothing health-wise has changed, and I do not drink. Have you heard if COVID might be the cause of this elevation?
So actually, David answered that question, and as he said, we're seeing that COVID can have all kinds of effects. So we have not specifically heard of a lot of cases where the liver enzymes are affected. This is another area where we just don't know at this time whether there's an effect or not.
Any idea the number of people who have long haul or have conditions created because of COVID, like heart or lung conditions?
Again, I think the data will tell us it's too early for us to tell. We know that obviously with there being a name for it, that there are some long-term sequelae and effects of COVID, but it's just too early for us to be able to have complete data on that.
Getting Delta, can I assume if I've lost taste and smell, it isn't Omicron?
I would not make that assumption. I have heard recently of folks, so the predominant virus in the community right now is Omicron, but I've heard of some recent cases of people presenting with loss of taste, sense of taste and smell. So I think Omicron can still do that. It's difficult to know, however, because while Omicron is absolutely the prevalent variant, there is still Delta in the community, and so I can't say with absolute certainty. But at this point, I would not consider that as a good way to differentiate which virus you have.
Or diagnose yourself. Does Omicron respond to therapeutic like monoclonal antibodies better than Delta? If so, what is the best therapeutic?
One of the things about Omicron is that it's so short-lived that by the time that you seek care, you probably are on the mend. But there is data that also says that there's some potential benefit from it. But there's also data that says that not necessarily. So again, I think it's an individual care thing that you should discuss with your provider to make a determination whether that's best for you.
Okay. It appears transmission is by both vaccinated and unvaccinated. Can we determine which is higher?
So the contact tracing has been a real challenge. That's how we would figure this out at this point. And contact tracing has been a real challenge right from the beginning for two big reasons. One is a lot of people are reluctant to tell us, who they've been with and when they were where, so on and so forth. So the number of potential contacts per case, usually we look for, 12 to 14 to 15, and we're sometimes getting as few as, 1 or 2 on average, depending on who we're talking to. So the other thing to try to answer this question is that we do know that those who are unvaccinated are much more likely to be more severely symptomatic. We also know that they produce more levels of virus. And so it would stand to reason that the unvaccinated are probably much more likely to spread. However, the definitive answer to that would come from really high granularity contact tracing, and I don't know that we have that yet.
Okay, we have about 5 minutes left, so I'm going to go a little faster, okay? And Dr. Brown, if I cut you off, I do it anyhow, okay? I'm getting discouraged as everyone around me seems to be catching the new variant. I wear a mask, but so did they. Others than staying home, locked down, what can I do as a preventive measure? I think you answered that earlier. We
did. So social distance, hand washing. If you're sick, you feel sick, stay home. Back to basics. Is there a benefit for school districts to cancel classes for just a couple of days? Since Omicron is so contagious, is there a number of days that would make a dent in the transmission? If so, does that benefit balance out the negative issues around keeping kids out of school? David.
Yeah, so this is a really complex question, which we probably don't have time for. It's controversial because, again, there's collateral damage that comes with closing the schools, and with it being so contagious, if there's some substance of the argument, why bother closing? As soon as you open it up, it's going to happen all over again. Another maybe complex issue.
The CDC website is baffling. There's a confusing chart that shows when to get a booster. They say moderately and severely immunocompromised can receive a booster shot or fourth dose 5 months after their third shot, and they are interchangeably called a fourth shot or booster. Please interpret.
Oh, gosh.
We have a
Quickly.
chart, actually.
Okay, yeah. And so actually they've changed the nomenclature of those terms as well. So the booster, just to try to
Dr. Hostes says a fourth dose would be too late to combat Omicron in the U.S. Could we have done this earlier?
So the other data that's coming out about fourth doses is in Israel, they're finding that the fourth dose is not increasing the antibody level very much, and so it doesn't appear to be a much advantage. So regardless of the timing, I don't think that we're going to be seeing fourth doses.
Moderna is targeting a combo flu and COVID booster by fall of 2023 at the earliest. Is this just for convenience, or is it supposed to be an improved dose?
So both. It'll be convenient so that people would only need one injection, but it's going to be probably an improved dose because they're moving towards using mRNA vaccine development technology for influenza, which we've never done before. So both.
Is it likely that the flu part of that's going to be more effective than a former flu vaccine?
Well, so we're going to have to wait and see. I think we were all pretty pleasantly surprised, shocked perhaps, at how effective the mRNA vaccines were when they came out. Now, influenza is a different virus, and we're just going to have to wait and see on that. But boy, wouldn't that be great?
Post-COVID, how long do you wait to get a second or third shot?
Yeah, this is a good question. And if you go to the CDC website, you have to dig really hard to find the answer to what they recommend. But basically, the answer is once you're symptom-free. This gets confused because in the UK, they recommended that people who are infected wait 90 days before they get their next shot. The reason the UK did that was that they were trying to stretch out their supply early on. But the current CDC recommendation is once you are completely symptom-free, you can go ahead and get your next immunization. Assuming you've waited long enough as you would have otherwise, right?
I'm pregnant and vaccinated. My unvaccinated friend and her 5-month-old both had COVID. Hers was rather severe. Will my vaccination protect my unborn child?
So again, that's an area that the jury is out on about the child, the fetus. However, the recommendation is that pregnant women do get vaccinated. Okay, it has been shown that they have better health when they are vaccinated, and unfortunately, as we saw on the news yesterday, we lost another mother of a newborn because she was not vaccinated.
What is the current definition of fully vaccinated?
It's still the primary series.
A new generic risk factor for loss of smell and taste has been found. Please comment.
Yeah, so there is an association. So what was done was they looked at a large number of people who were infected with COVID. They took those who had the symptom of loss of sense of taste and smell. They did analyses of their basic genome, and they found an association between two genetic characteristics of the people, that they seem to have a higher incidence of the loss of sense of taste. Now, is that causative? Is that correlative? Or is it just an association? We don't know yet.
A TV report on Tuesday said the U.S. faces a wave of Omicron deaths in the coming weeks as deaths are climbing. Is this true?
I think it's early to tell. As David spoke a little bit earlier, that is a lagging indicator, and we are seeing a little bit of increase in the deaths. But again, I think it's too early to tell.
Thank you for joining us for COVID-19 Talk with Local Health Authorities. Joining us from Harris County is Dr. Erica Brown. From the City of Houston, Dr. David Purse. Thank you to past President Kathy Finninger, Rotary Club of Houston, and our producer, Morgan Ash. I'm Stephen Williams, Director of the Houston Health Department.